When treatment is initiated, patients will experience a relative euphoria. The increase in dopamine causes an elevation in mood, and this is why it can be a problem for patients with endogenous, idiopathic, or familial bipolar disorder. But often patients, even those that are not intending to take the medication recreationally, but that truly want it for its intended purpose, they will feel that euphoria, and that euphoria does tend to wane over time. It's dose dependent, and so often patients will return and they'll complain that the medication isn't working anymore because they don't feel it. And it's important to understand that that's really a side effect. It may be a welcome effect. Most patients welcome the confidence and the energy that they feel from that medication. It's not so much an antidepressant effect, although those medications can be used as adjuncts in the treatment of major depression. But for individuals who are euthymic to begin with, it's not an antidepressant effect, it's actually a mood elevating effect that results in a better than average mood. The problem is that that can then spill over into mania or irritability, particularly as the medication is wearing off. So it does have a mood effect, but that is not what the medications are approved for by the FDA. Again, it's used off-label to treat refractory depression. I use it off-label in individuals who wish to improve their concentration and their attention and who are acceptable candidates for that. But we don't adjust the dosage based on that particular effect. And that's how patients often end up on very high doses, because as they begin to develop tolerance to that effect, they come back to their prescriber and they're really chasing a side effect that is more than what one needs for sustained attention and concentration. That's not to say that I don't often increase the dosage as patients report to me that the medication isn't lasting all day, or they're running out of steam midday, they're actually having some rebound symptoms that include lethargy, dysphoria, usually irritability, edginess, tension, anxiety, and rebound inattention. And so we do often have to titrate the dosage. But it's important to explain to patients what the intended effect is and what the side effects are. The other side effect that patients will develop tolerance to over a period of weeks to months is the anorexigenic effect. These medications induce anorexia, meaning that they dampen the appetite, and they do so quite significantly and quite powerfully. They are approved for short-term use in individuals who are obese or individuals with binge eating disorder. Vyvanse is one medication specifically approved for that because the dopaminergic effect gives those individuals control over their addiction to food and to eating. And certainly in an individual who's trying to lose weight, to lower their BMI, their body mass index, to something that's healthier in order to better control their blood sugars or their blood pressure, to feel better, it's a valid and welcome side effect, but it does tend to diminish over time. And so those individuals who are using stimulants in order to lose weight, in order to diet more effectively, need to really concentrate their efforts in the first few weeks of treatment, and to combine that with sensible eating, not skipping meals, because it's very easy to forget to eat, and then that leads to hypoglycemia, which leads to physical illness. People break into a cold sweat, they're nauseated, it's very uncomfortable, it can be dangerous, and it is very common in individuals who are so focused on what they're doing, usually because the dose is a little too high, that they forget about eating, or if they think about it, they can't tear themselves away from the task at hand. That's called hyper-focusing, or else they make a conscious decision not to eat because they're not hungry. And even those individuals who are trying to lose weight need to eat something. They need to keep their blood sugar in the normal range to avoid feeling sick, to avoid making themselves sick. And then as they develop tolerance to that side effect, hopefully at that point their lifestyle changes that they've made in terms of diet, what they're actually eating, portion control, and an exercise regimen can keep them in remission from obesity. Binge eating disorder itself is treated chronically, and although the intensity of the anorexia effect will wane even in those individuals over time, they do not lose the control that that medication otherwise gives them to be able to diet, to be able to resist overeating, and to not be obsessed with food, which is what we see in that condition. So it can be used long term for that indication, but all individuals will develop tolerance